imagine stepping into a hospital, it's chaos maybe, and suddenly you hear nurses talking in what sounds like code.
Yeah, like stat order for the NPO patient with CHF.
Exactly. Or check the patient's ADLs and document their INO-Q4H. It sounds like this whole secret society thing.
But it's not. It's just,
Yeah.
well, it's the daily reality of healthcare communication.
Yeah.
It has to be fast.
Welcome to the deep dive. Today, we're sort of pulling back the curtain on that secret language, these essential abbreviations and all the shorthand that nurses and other healthcare professionals use constantly.
We've really dug into a comprehensive list, the vocabulary, the abbreviations.
Right, and our mission really is to distill the most important stuff for you.
Yeah, to unpack what they actually mean.
And why they are just absolutely crucial for patient care, for communication, and how, just understanding a few can give you this, fascinating shortcut into how efficient the medical world has to be.
Get ready for some real aha moments, I think.
Definitely. About how healthcare really works behind the scenes. The deep dive. Decoding the language of care. The pace of care. Time, frequency, and criticality. Okay, so let's kick off with something that just defines healthcare. Speed.
Yeah.
And precision.
Yeah.
This first category of abbreviations, it really emphasizes that. I found it immediately telling about the rhythm of a hospital.
It's fascinating, isn't it? These abbreviations aren't just like lazy shorthand.
Nope.
They're a direct reflection of the urgency and the meticulous timing needed in patient care. They streamline critical instructions.
Make sure everyone's on the same page instantly.
Exactly.
And nothing screams instant quite like stat. I always thought that was just a dramatic TV thing.
Yeah, we all do. But no, our sources confirm it just means immediately, like now.
An order for something that absolutely cannot wait.
Right. Think of it like this. A stat medication order. It needs to be given right now, probably within minutes. The patient's condition is acute. Time is critical.
Okay, so contrast that with PRN.
Yeah.
That sounds less intense.
Much less intense. It means as needed. So a PRN pain medication, for example, it gives the nurse or sometimes even the patient the flexibility. Give it only when symptoms pop up.
Okay, so I'm misunderstanding that difference. Stat versus PRN. That could genuinely change things for a patient.
Huge difference. Immediate action versus flexible approach.
Yeah.
Critical.
Right. And then you've got the everyday rhythm of care, all about frequency. We see common ones like BA.
Yep, twice a day.
NTID.
3 times a day.
QID.
4 times a day. It's just efficient.
It really is.
Yeah.
And beyond those, the precision ramps up even more, right? With terms like QH.
QH is every hour. Or
Yeah.
QH, Q3H, Q4H every 2, 3, or 4 hours.
No, these aren't suggestions.
No way. They're precise intervals. They guide everything. Vital sign checks, meds. A nurse glances at a chart. They know instantly when the last thing happened and when the next one's due.
They even have abbreviations that fit into the patient's natural day. I thought this was smart. Quam.
Every morning, every night. And QHS, which is at every bedtime, literally every hour of sleep.
It's about weaving the care into their daily rhythm.
Exactly. And that structured approach,
Yeah.
it can stretch out longer too. You'll see QD for every day.
Okay.
Or code for every other day. Even things like 2x/K 2 times a week shows how healthcare plans are systematic, even when it's not minute by minute.
And meals, obviously, a big part of the day. So there's shorthand.
Before meals,
What's for meals?
after meals. Simple, yeah, but crucial for meds that need food or don't.
Right.
And what's also key, I think, for understanding patient-centered care is a term like ad-lib.
Ad-lib, like improvisation.
Sort of. It stands for as desired or no restriction. It gives the patient autonomy. It's like a medical green light to do something, maybe get out of bed, without specific limits.
That's a nice contrast to the really strict stat or the precise Q&O orders.
Exactly. It shows that balance.
So for you listening, understanding these isn't just knowing acronyms. It's grasping the sheer speed, the careful timing that dictates patient care.
Yeah, it's knowing that a tiny abbreviation represents a critical decision. 2. Patient status and daily function. Understanding the patient experience.
Okay, this next section. This is where it gets really interesting for me because it moves beyond just meds and timings to how nurses quickly convey a patient's overall state, their capabilities, basic daily needs.
Right, and it raises that important question. How do you capture a person's day-to-day reality, their independence, their challenges, in just a few letters?
Yeah.
These abbreviations, they show the truly holistic nature of nursing assessment, looking at the whole patient, not just the illness.
Let's start with the foundational one, ANO.
Alert and oriented. It's a super quick mental status check. Tells you a lot about cognitive function right off the bat.
Okay, makes sense. And then you get into the really practical stuff. Daily life, ADLs.
Activities of daily living. This one's powerful. It covers basics like bathing, dressing, eating, mobility.
So if a chart says a patient needs help with ADLs.
That instantly tells you a lot about their care needs. It impacts staffing, discharge planning, everything. A tiny abbreviation with massive implications for resources for patient's journey to recovery.
Wow, okay. That's definitely an aha moment, how a few letters mean so much planning.
Totally.
And on the basic bodily function side, we see BM.
Bowel movement.
Wow.
Intake and output. Dragging fluids, basically. Super important for hydration, kidney function.
And a really critical one, NPO.
Nothing by mouth. Nil per os, technically.
Okay, NPO. That sounds simple, but you flagged it as vital.
Oh, absolutely. It's a vital safety instruction.
Yeah.
If a patient is NPO before surgery, it's to prevent aspiration, inhaling food or liquid into the lungs.
Which can be really dangerous.
Life-threatening complications, yeah.
Yeah.
A single misplaced cracker, a sip of water.
Yeah.
It could put a patient in serious danger if they're NPO. It's a prime example of how brevity in healthcare is often really about safety.
Got it. Wow. Okay, mobility is another huge area. We got OOB,
Out of bed,
BRP,
bathroom privileges,
MBSC.
bedside commode. These quickly tell you how a patient's getting around managing their own toileting needs.
And it gets even more detailed for movement positioning, like WC.
Wheelchair. ROM is range of motion exercises keeping joints flexible.
Okay.
And TMP is turn and position. That's crucial for preventing pressure sores, bed sores, in patients who can't move much.
Right. And HOB.
Head of bed, indicating its elevation, which can be important for breathing or preventing reflux. Lots of reasons.
Then there's basic needs, hygiene, PPE. We all know that one now.
Yeah, personal protective equipment, masks, gloves, gowns. Then ISOL means a patient's in isolation.
And ink.
Incontinent. Needs help managing bladder or bowel control.
And even super basic stuff like H2O for water or O2 for oxygen gets the shorthand treatment.
Yeah. So this whole collection, it paints this quick, comprehensive picture of a patient. Their independence, their limits, the specific help they need.
It really highlights that holistic side of nursing care, way beyond just giving shots.
Exactly. 3, the numbers game. Vitals, measurements, and diagnostics.
Okay, so we've got the rhythm of care, the daily function. Now we shift to the crucial numbers, the tests, the stuff that underpins diagnosis and treatment.
Right.
This feels like the objective data points, the things that tell the patient's physical story.
Exactly. If you connect this to the bigger picture, these terms are like the universal language of patient status. They provide concrete, measurable evidence.
What's happening inside?
Yeah. Guiding every medical decision, ensuring precision.
Let's start with the most fundamental, VS.
Vital signs, the umbrella term.
And under that umbrella, T for temperature.
Yep. E for pulse.
R for respiration.
EP for blood pressure.
Yeah.
And O2 sat for oxygen saturation.
That's the immediate snapshot, right? The life signs.
Absolutely. And within vitals, you'll often see BPM tacked on for pulse beats per minute.
Okay. And when it comes to measurements generally, the abbreviations are all about extreme precision, like fluids, weight.
You'll see ml for milliliter, L for liter, Oz for ounce.
Pound for pound, kilogram for kilogram.
And for smaller, more precise amounts, like meds. TSP for teaspoon, GM for gram, MG for milligram.
Dimensions too.
Yep. FT for foot, centimeter for centimeter, millimeter for millimeter. And of course, for blood pressure, the classic mmHg.
Millimeters of mercury. Still using mercury.
About the measurement standard, yeah.
And time units get abbreviated too, just for charting efficiency. MEHIH or HR.
For hour. And min for minute. Practical.
Okay, beyond the routine numbers, the diagnostic tests. These are critical for figuring out what's wrong. UA.
Urinalysis.
Yeah.
Basic, but tells you a lot.
EBG.
Arterial blood gas. Gives a really important snapshot of lung and kidney function, oxygen levels in the blood.
And CNS.
Culture and sensitivity. Super important for infections.
Yes.
Identifies the bacteria.
And tells you which antibiotics will actually work against it.
Exactly. Avoids guessing.
Then the imaging tests, the electrical ones, giving doctors and nurses that view inside the body. CT.
Computed tomography scan.
CXR.
Chest x-ray.
Very common.
And the heart's electrical activity. ECG or EKG. Electrocardiogram. Same thing. Different abbreviation preference sometimes.
Okay. And for brain activity.
EEG. Electroencephalogram.
And the more advanced imaging. MRI.
Magnetic resonance imaging.
And US.
Ultrasound. Each one quickly tells the team what kind of deep diagnostic info they're looking at.
So these are really the essential data points nurses collect, communicate. They form the foundation, right, for assessment, for making sure care is based on objective facts.
Yeah, it's how they build that clear, evidence-based picture of what's really going on with the patient. 4, demystifying conditions, treatments, and anatomy.
Okay, this section, this really starts to feel like decoding a secret medical dictionary. It covers everything from, common illnesses to specific body parts.
It really does.
It's amazing how much information just a few letters can pack in.
It truly is. And it highlights the sheer scope of knowledge a nurse needs, from systemic conditions like heart failure down to very localized anatomy.
All communicated concisely for speed.
For speed, for understanding, it's action. In an emergency, knowing the shorthand for a condition saves precious seconds.
Let's start with some common conditions. NKA.
No known allergies.
Yeah,
Crucial safety note. Jumps right out on a chart.
huge. Then we have diseases like AD,
Alzheimer's disease,
CHF,
congestive heart failure,
COPD.
chronic obstructive pulmonary disease.
Uh,
I hadn't fully grasped how quickly these tell a whole story until I really thought about the context. Precisely. And then you have acute events, CVA,
Cerebrovascular accident,
Yeah.
stroke,
yeah, and MI.
myocardial infarction, heart attack,
Common symptoms get abbreviated too, like SOB.
shortness of breath. Knowing these means a nurse can just glance at a chart and get the patient's core problem instantly.
Yeah.
Speeds things up.
Definitely. You also see common infections abbreviated, URI.
Upper respiratory infection, like a cold.
Yeah.
And UTI.
Urinary tract infection.
And then there are more specific infections that need really careful handling. C. diff.
Clostridium difficile.
Yeah.
Nasty stuff.
Very. MRSA. Methicillin-resistant Staphylococcus aureus. The superbug.
Right. And STD-STI for sexually transmitted disease or infection. Plus TB for tuberculosis. These are vital for infection control procedures.
Got it. General medical terms too. DX or DX.
Diagnosis.
And prefixes like hyper
Above normal, like
Right.
hypertension, high blood pressure.
and hypo.
Below normal, hypoglycemia, low blood sugar.
Also SNS.
Signs and symptoms, what the patient presents with.
Then there's anatomy, location, simple ones like L and R.
Left and right,
Yeah.
essential, LE for lower extremity.
Legs.
Yep, and UE for upper extremity.
Sure.
More specific parts too, like for abdomen. This helps pinpoint where a problem is fast.
And directional terms.
Anterior, front, posterior,
lateral, side.
and for internal organs, you get really specific. LLL, RLL, left lower, right lower lobe. Usually talking about the lungs.
Okay. Or LUQ, RUQ.
Left upper quadrant, right upper quadrant. Dividing up the abdomen for pinpointing pain or findings. This level of detail in shorthand. It's impressive. It has to be. Treatments and procedures also get abbreviated. 4.
Intravenous.
Treatment.
General term.
Yep. And we mentioned ROM, range of motion, before for assessment, but here it can also be a treatment, like ordering ROM exercises.
Okay. And PTE, again, personal protective equipment, but used like a procedure.
Exactly. Donning PPE is a procedure for safety doing care.
So for you listening, understanding these helps you instantly grasp the patient's illness, the specific body part affected. It really shows the precision needed in healthcare talk.
It's like getting the plot and the setting of the medical story in one quick phrase. V, the healthcare team and environment. Who and where.
All right, finally, let's zoom out just a bit. Look at the people, the places, the whole system that makes healthcare run, because it's definitely a team effort.
Absolutely. This final group of abbreviations, it really emphasizes that collaborative nature. It shows how different roles and settings are clearly defined for efficient care.
Make sure everyone knows who's doing what and where.
Exactly. When it comes to roles, we see CNA.
Certified nursing assistant,
Those-
director of nursing, management role,
Yep, LPN, LVN,
licensed practical nurse or licensed vocational nurse, depending on the state,
NA.
nursing assistant, and of course, the central figure often, RN, registered nurse. Each has a distinct function, a different scope of practice.
And locations are just as vital. Directing care, knowing where patients are in the system, ER or ED,
Emergency room or emergency department, same place, different names.
LTC,
Long-term care
like a nursing home.
and rehab.
Rehabilitation facility for recovery after injury or surgery. It tells the whole care journey sometimes.
We also find YO used in charts.
Just means years old. Quick way to meet the patient's age. So these terms, they help you quickly identify who is providing the care, where it's happening, gives you a clearer picture of the whole healthcare landscape.
And the essential teamwork involved. Outro. Wow, we've taken a truly fascinating deep dive into this world of nursing abbreviations. I mean, from the critical urgency of stat,
To the daily rhythm of
from
quant,
the precise language of VS, vital signs.
to the condition shorthand like CHF.
Yeah.
These abbreviations are really truly the backbone of efficient, safe patient care.
You now have this unique glimpse into the vital communication happening behind the scenes. It hopefully demystifies a language that impacts millions every single day.
You're definitely better equipped now to understand the nuances of medical documentation, the sheer precision required. It's like a small shortcut to being more informed about a complex system.
So as you go about your day, maybe consider this thought. While this need for extreme brevity, this clarity, is absolutely essential for speed and safety in healthcare, could it also sometimes create a communication barrier, for patients, for their families?
That's a really interesting point.
How can we, as maybe more informed individuals now, help bridge that gap? And what responsibilities do healthcare systems have in making this crucial language maybe a bit more accessible?
Without compromising that lightning-fast, life-saving communication needed in a crisis.
Exactly. It's a balance, isn't it?
A balance we all benefit from understanding better.